Hello friends, I am Dr. Parikh. I am a hepatologist at Reliver Clinic and Apollo Hospitals, Ahmedabad. Today I am going to talk about the journey from the development and diagnosis of cirrhosis to the need for liver transplant and the cure or post-liver transplant. So first of all, once any injury or a precipitating event causes damage to the liver over a period of few years to few decades, this injury becomes irreversible, and that is when we label this disease as cirrhosis of liver, or better termed as advanced chronic liver disease. After development of cirrhosis or ACLD or advanced chronic liver disease, patients do not develop symptoms for a period of few weeks to few months and sometimes to few years, as the remaining liver is able to cope up with the functions of the liver in that period. However, as the cirrhosis progresses, the remaining liver's function also starts deteriorating, and as a result, the liver is not able to cope up with the normal bodily functions, and that's when the complications starts occurring. In India, the usual two most common complications that we see is fluid accumulation in the tummy or swelling of the feet, and second is vomiting of blood or black colored stool. These two are evidence of what we call it as portal hypertension. Once these complications occur, your gastroenterologist and hepatologist would manage this disease by controlling the portal hypertension and by giving you water tablets or diuretics and by doing an endoscopy and taking care of the bleeding sites. After a period of time, once the liver function further deteriorates, your platelet starts going down, your bilirubin starts rising, that is when you develop jaundice. There is some complication of losing muscle mass or wasting. There is some effect on the brain's functioning or clouding of the brain. Sometimes it also affects the kidneys and causing kidney injury or rise in creatinine. Once you start developing these complications, your doctor would advise you to start getting evaluated for liver transplant. Once this complication occurs within a few weeks, few months, you may require a liver transplant. Now, once you get a liver transplant done, 2 to 3 months down the line, all these complications would have disappeared. You would have regained your muscle mass. Your medicines would be again back to a few basic medicines, and you would be able to function normally. So, cirrhosis is not an end of life. Once you develop cirrhosis, not everybody would develop complication immediately, but once they develop complication of synthetic dysfunction, they usually are irreversible and need a liver transplant. A timely liver transplant in this case saves lives and prevents further complication of other organs. Once the other organs get involved, it is very difficult to reverse those, and that is when we end up losing a life. So if you have any such synthetic dysfunction related complications, please inquire with your gastroenterologist or a hepatologist about an accurate timing for liver transplant. Thank you.